So a very common question that I get are from patients regarding shoulder surgery is, how long do I have to sleep in a recliner after shoulder surgery? And I'm here to tell you, never, right? Like, don't, or do if you want to, but you do. I don't make anyone sleep in a recliner after shoulder surgery. I don't know where this came from, like why this got passed down through the generations, because there's no evidence, no literature, and it doesn't actually even make a lot of sense to me why you need to have someone sleep in a recliner after shoulder surgery. I think part of it is patients are having trouble sleeping beforehand, and there are certain positions for sure that are uncomfortable on your shoulder in your bed, but to have to say, oh, well, we're gonna have to put you in a recliner for 6 weeks or 3 months is, to me, it's ridiculous, right? And I'll tell you a funny story. I've had surgery on my own shoulder twice. And, the night after surgery, I was having some discomfort, and, I was like, well, maybe I'll go try this recliner thing and just see what it's like. And so I go and I sit in this recliner and I'm leaning back in it. And I remember as I was falling asleep, I had taken a couple of the pain pills, and I fell out of the recliner, and I was like, okay, I'm never doing that again, right? It didn't help at all, and I almost landed on my shoulder that I just had surgery on the day before. So what I recommend is actually sleeping in your own bed, but putting a bunch of pillows up the back of the bed. So you're maybe at 20 or 30 degrees incline, so your back's like this, and then stacking a bunch of pillows underneath your operative shoulder. And so you're just kind of you're not fully sitting up like a recliner, but you're sitting up a little bit just for the sake of getting your shoulder propped up on some pillows. And I have found that is by far the most comfortable position. So you're in your own bed, you're just putting a couple pillows up behind your back, so you're maybe at a slight incline, and then you're stacking them up underneath your arm, and you can also kind of lean on your other side, and so you're kind of like in the lazy beach chair is what you want to be, right? So you're leaned back, arm is propped up on some pillows. You can even kind of lay on the other side, and that is so much more comfortable. And you have to sleep, right? And that's why a lot of patients are having surgery on their shoulder, is because they can't sleep. And then after surgery, they hear, oh, you have to sleep in a recliner for 6 weeks. So they're like, I'm not going to sleep I'm going to sleep terribly after the surgery. So I think I don't understand why it's gotten pressed down through the generations. If you want to sleep in a recliner, try it. But we tell all our patients, we don't care how you sleep. We want you to find the most comfortable position. I have found that staying in your bed and using that kind of pillow method is by far the most effective. And if you go on our website, we have a whole article or a whole video where it talks about sleeping with shoulder pain and how to do it in a systematic way so that you can get through the nights, whether you had surgery or not, because a lot of people's shoulders are keeping them up at night. And so you do not have to sleep in a recliner after shoulder surgery unless you choose to, right? But I would try the other method first, because then you're in your own bed. Everybody knows when you travel or whatever, you come home, there's something about being in your own bed. Just the comfort of being there, the familiarity of it. Everyone sleeps the best in their own bed. So get in your own bed, use our method, and it'll make your recovery way, way more, or less painful, less arduous than if you're having to go downstairs and sleep in a recliner every day or every night for 6 weeks or 3 months after surgery.